This topic is on ethics and upholding the values of San Ysidro Health. This is a pretty, I would say, short presentation. It's a pretty short topic on ethics and the values of San Ysidro Health. So, can somebody put in the chat what the word ethics or the term ethics means? Or you? What do you understand as ethics? The morals. Yeah. So in this presentation, we're just gonna see how do we define ethics, what's the importance of ethics in healthcare, the multidisciplinary effects of ethics, cultural differences in ethics, how to utilize ethical principles as guidelines for decision making in patient care. And you will learn what the values of San Ysidro Hill and San Diego Pace are. So what is ethics? Ethics and morality are often used interchangeably, but have a subtle difference. Ethics is a set of moral principles that govern the person's behavior, and a branch of knowledge and philosophy that ponders and studies more moral principles. Ethics are not the law. However, laws can be guided by ethics. Laws can be considered unethical as well. So, in a simpler definition or way that we can define ethics is ethics refers to well-founded standards of right and wrong. Somebody mentioned morals. So the standards of right and wrong that prescribe what humans ought to do, usually in terms of rights, obligations, benefits to society, fairness, or specific virtues. Ethics is the study of moral principles that guide people's behaviors and decision making. So we are in our everyday influenced by ethics and morals, and that's how we uh, make decisions. What no, we guide our lives on what is right or wrong. So it can also be defined as a method for analyzing problems and deciding how to act whenever we have a problems. Ethics can be applied to many areas of life that include personal, business, and also the legal part. At a personal life, ethics can help people to make choices that contribute to the common good, such as telling the truth, keeping promises, and helping others. That's how it applies ethics in our personal lives. In business life, ethics can help people make choices that are reasonable and well-founded. And on a legal context, ethics can define how people interact with each other. For example, a farmer might not be violating the ethics of society if they kill male chicks, but animal rights activists might disagree. So, and the legal context, it is also applied ethics. Why we care. In healthcare, we take action to prevent morbidity and mortality, but our actions are influenced by what we should do, what we are able to do, and what we are permitted to do. So in healthcare, we try to keep people's healthy, but also there's a bunch of different rules and stipulations and on what we should do, what we are able to do, and what we are permitted to do based on ethics. What is an ethical dilemma? Ethical dilemmas arise when values conflict, when there is no consensus on right and wrong, when motivation is unclear, a choice must be made between two or more equal alternatives. Um, then we have bioethics. Bioethics are the ethicals or ethics that are used in healthcare. The specific moral issues and problems that arise within modern medicine, medical research, and technology. Ethical and bioethical issues can collide and cause conflict between personal, organizational, and legal principles. There's the part that is ethical, what we know is right and wrong, which also can have conflicts with the bioethical um, issues. Bioethics is a field of study and professional practice that they examine ethical issues in healthcare, especially those that arise from advances in medicine, biology, and technology. It's the application of ethics to the field of medicine and healthcare. That's what bioethics means. Bio, bioethicists and ethics ask questions rather than provide answers. So the goal of bioethics is to ensure that healthcare providers make informed decisions that respect patients' values, beliefs, and rights. Some examples that we can have when it comes to bioethics has focus on, um, for example, euthanasia. Have you ever heard of that? The assistance for death. It's a controversial topic that involves ending the life of a very sick person to relieve their suffering. So there's topics in bioethics that focus on that, like who does decide this? Is it right? Is it wrong? And again, it's based on personal ethics a lot of times. Also, organ donation and transplantation, a topic that has been to the focus of bioethics for a very long time. Like who decides, who goes first, who's gonna have the next kidney transplantation, things like that. Like who decides the person or their priority. And also genetic research. It is a topic that has been the focus of bioethics for very long time. You know, scientists investigating our genetics in order to maybe find cures or solutions to health conditions. Also create this controversy on in the world about ethics. You know, a lot of people believe that might be have their own beliefs and opinions on like why scientists or doctors sometimes play like the God role when they have a strong religious beliefs, you know? So it creates this controversy. Uh, Also, we have dead and dying. It is a topic that has been the focus in bioethics for a very long time. And environmental concerns, which is a topic that has been the focus of bioethics and also for a long time. Other current ethical issues that are the forefront of controversial debates include the definition of death, autonomy, medical paternalism, and healthcare rationing. So those are some of the topics that we can find when in bioethics and that have created debates for some time. Let's understand a little more of bioethics. Let me share the sound.
When I trained in medicine, on my first day as an intern, I was given a list of patients, and I walked in the door to see the first one, and it was a woman who was sitting eating her breakfast, cutting her grapefruit, I remember, and the sun was streaming in. We had a nice conversation. And then I walked out in the hall, and my supervisor saw me, my resident, and said, "What have you been doing so far?" And I said, "Well, I just spoke to Mrs. Jones." He said, "She's dead. Don't waste your time with the dead." I said, "What do you mean she's dead? I just spoke with her." "She's dead. Don't waste your time with the dead." And in his mind, she had terminal cancer. She was labeled do not resuscitate, and it wasn't worth my time, wasting my time with her. Then he turned to me and said, "And besides, something just came down into the ER and we should go down and take a look." Something, a patient, presumably, a person. And so I began to realize how important it was to look at the underlying human side of medicine, not just the science of what we're doing, but the assumptions we make, and the need to pay closer attention to the larger social, psychological, moral, cultural, and ethical issues involved in what we do in healthcare. And the field that looks at that is bioethics. Bioethics is a fairly new field, but it looks at the ethical, legal, social, cultural implications of advances in biotechnology and healthcare. And of course, there are an increasing number of issues in this area that we're all facing every day, whether we're patients, whether we're family members of patients, or whether we are doctors or nurses or other healthcare providers, whether we're voters or taxpayers.
So you can see from this video is basically the guidelines that are newly created in order to ensure that healthcare providers make informed decisions that respect patients' values, again, beliefs and rights, what is wrong and right in the medical area, healthcare area. Ethical issues in modern healthcare. There's modern in the modern healthcare and research. There's issues that arise when legal, personal, and organizational value collide, as we saw. At a more close aspect in our daily lives, we can see, for example, mandates. Does a public safety supersede an individual's rights? Clinics with the rise of COVID were requiring the use of masks. It was a mandated, and a lot of people was against it because they believe that it was violating their personal and individual rights. So that's what we have a clear example of when personal ethics collide with organizational ethics, in this case from clinics and hospitals requiring mask mandates. Also, should a parent have the right to refuse immunization for their child? And the answer would be yes, right? Parents have the right to refuse immunizations for their child. However, if they're considering sending their kids for to a public school, The school has regulations, has ethics, right? They require kids to have all of their immunizations to prevent the spreadness of diseases. That collides with the personal values. A lot of times, parents cannot afford can't afford private schooling or cannot stop working in order to do home education. So they would have to therefore follow with the ethics guidelines of the school and having their kids to get the immunizations that they need. Other should life-saving medical procedures be conducted without explicit consent? You as a patient would be okay with doctors performing life-saving procedures without your consent? That's another issue in modern healthcare. Now, should a medical professional have the right to refuse medically necessary procedures with patient consent? If you do not consent a procedure and you refuse it, that does the doctor have the right to refuse it as well? And who deserves transplantation, and how do we rank those in need when it comes to organs? Who decides who goes first? How do we rank the needs? So there are a lot of controversies in the healthcare when it comes to ethics and its issues in modern healthcare. Diversity in ethical understanding. The fundamental question in ethics: does race, ethnicity, culture, language, or environment impacts one's moral and ethical views? Can you type it in the chat? Does a race, ethnicity, culture, language, or environment impact one's moral and ethical views? Nobody? Okay. Well, yes, it does. It impacts ethical views when there's race, ethnicity, and culture, language, and environment impact involved. Uh, People have different cultural backgrounds. They're from different ethnicities. They have different languages, and this influences and questions in ethics. Hispanic people, for example, might not have the same ethical views that people from Asia. Middle Eastern people would not have the same views as Americans. So this impacts um, the ethical understanding. But you could argue subject. Yes, ring. Now, should one's personal moral and ethical views impact the nature of work or duties as a healthcare professionals? And the answer would be no. Your personal moral and ethical views should not impact um, the nature of your work. When you sign up for this job of taking care of people, you are well aware that you might have clients that are from different backgrounds, right? They will have different culture, maybe. They will have a different ethnicity than you. They're from a different race than you. They might even have different language than you. So that should not impact how you perform your work. When you come into the healthcare, you have to keep in mind that you have to put your beliefs and your moral aside. That cannot influence on how you perform care. You need to learn how to manage that. Otherwise, this is not the field that you should be. If you believe that this is gonna influence how you treat somebody with HIV or somebody from the LGBTQ community, if it is a gay man, a lesbian woman, a trans person, if that affects you or the personal level to the point that you are not able to provide good care for them, then this is not the environment for you, and you should consider looking for other fields to work, because when we work in this field providing care for others, we have to be mindful. And at the end, everybody's human and you want to treat others as you want to be treated. So no, should personal moral and ethical views should not impact the nature of your work. Moving forward, um, impact on care. There's cultural difference in healthcare that can impact the entire healthcare system. For example, the quality of care provided, consent to receive care DNRs, for example, communication language barriers, stereotyping and assumptions, as well as legal issues that are regarding HIPAA or privacy laws, and the veracity, the duty to tell the truth. Those are cultural differences in healthcare that can impact the entire healthcare system when we are providing um, home care for a patient that is not, maybe doesn't speak English, and maybe that person speaks Spanish or Arabic and you do not speak that language. That can create an impact on the healthcare system and how we provide care for that person. So it is important to make sure that those are overcome in order to provide people with the proper care. Creating an understanding agreement. It is crucial to that organizations define a common ground, a mission, and a code of ethics for employees to follow. That's why we have guidelines. That's why every company has policies. Potential employees or current staff and patients choose to opt in to the organization codes of ethics. So these groups of policies not only apply for employees, but also patients and their families. When they take our services, they have to be fully aware that, what are our policies and what we can do. So they opt into the organization's code of ethics, and they must follow all applicable laws and remain fidelity, and must be widely acceptable by a group, community, or society, and must prioritize patient care. So in healthcare organizations like San Ysidro Health, the priority is patient care. San Ysidro Health and San Diego Space are nonprofit organizations that are committed to high quality, compassionate, and accessible and affordable services. For San Ysidro Health, the mission is to improve the health and well being of communities we serve with access for all. Uh, while San Diego Pays missions is to ensure seniors get the care they need to live healthy, happy, and independent lives. Those are San Isidro's uh, and San Diego Pays missions to improve the health and well-being of communities that we serve. The values for San Isidro Health are respect, excellence, integrity, and empowerment. We respect, we demonstrate courtesy and treat every customer and employee with dignity in every interaction. Through excellence, we provide the highest level of service. We strive for quality and continuous improvement. We're thoughtful, accountable for our actions, willing to admit mistakes, and rigorous in correcting them. Through integrity, we act with the highest ethical principle. We maintain the trust of confidence of all we engage. We do what we say. And through empowerment, we provide a safe work environment to stimulate ownership and pride in our decisions and actions. Those are the values that San Isidro is led by, and that employees are encouraged to. Employees are supposed to show respect at all times for customers and to others around, working around you. Now, why did San Isidro choose this as its values? Remember, the mission is to provide the well care and safe care and healthcare services to our community, improving their health. Which one would be the most important to you? Can anybody tell me which of these values is most important to you? Respect. Okay. Who else? Integrity. Okay, Jen. All of them. Okay. And which is the hardest to uphold? Which one do you think is the hardest of all of the values that we have to uphold? Integrity. Okay. Everybody has their own, like you have the what you consider the most important. Respect, of course, it's one that most people can agree that is very important to demonstrate courtesy and treat every other with dignity, not only in when it comes to San Isidro, but also in your real world, in your everyday. And respect can be the hardest for some people to uphold. We demand respect, but sometimes it's hard to also demonstrate respect to others. So now you are familiar with which are the values for San Isidro Health and what ethics are, how are procedures and policies at San Isidro Health created, and there's a reason behind of why. And this apply can be applied on an everyday basis as well on our lives. So I think that's all the information I have on this topic today. If anybody has a question on ethics, please let me know and I can answer that to you. Otherwise, as I said, it was a very short uh, topic today, understanding ethics, how they are applied in healthcare, and San Isidro's values and mission. And of course, if you don't have any questions, you're free to go.